There are really so many factors that are going to be determining whether or not IVF is successful for any individual patient. There are some obvious ones that I think everyone would recognise, things like the woman's age in the course of the treatment. But I think it's very important to stress that there are many factors that will influence whether or not the treatment succeeds that won't be known about until the treatment actually starts. And that's specifically things like how many eggs are going to be available in the course of the treatment, and therefore how many embryos are likely to be available, and what the quality of those embryos are. And all those things are really going to have a dramatic effect on the possible outcome from the treatment itself. And I think that's why it's very, very important to stress that at all points the patient should really be talking to their doctor about how things are going in the course of a treatment cycle. The success of IVF these days is really very good, and for those of us who've worked in this field for 25 to 30 years, I think sometimes we forget just how far we've come in terms of success rates. The chances of having a baby are really far better than not having a baby when you come if you're an appropriate patient for IVF, and I think that's really a remarkable achievement in our field. And I think another way of expressing that is to say that now 4% of all the babies, 1 in every 25 babies that's born in Australia, is conceived as a result of IVF. And that's really quite a remarkable figure, and a figure that those of us who work in the field are really very proud of. One consideration that's likely to be important in determining the success of a treatment is which strategy we use to select the embryos that we're going to transfer. And within the field, there's always been a lot of debate about whether they should be transferred at early stages, or what we would call cleavage stages. That's usually after 2 or 3 days of development, or whether they be transferred at later stages on day 5, a stage which is usually referred to as the blastocyst stage. And people talk a lot about blastocyst transfer and its potential benefits. At Melbourne IVF, we believe in flexibility, and if we can gain information about the embryo at a very early stage, we believe that that's the point at which we should transfer the embryo and not extend that culture period any longer than necessary. However, with a flexible approach, we also believe that we can extend that culture period and transfer at the blastocyst stage when that's appropriate for the patient. And again, this is something that the doctor will decide in consultation with both the laboratory and the patient in the course of treatment. The key thing to remember when looking at any success rate from IVF treatment is that that success rate will be based on a population of patients. And of course, a population of patients is made up of many individuals, and each individual will have particular circumstances that make them different from the population as a whole. And it would be wrong to try and make it over simple. What I can say from our data, and we have large amounts of data available in a clinic of our size, is that for a patient under the age of 36 who has 3 embryos available, and that would be the majority of patients in that age group, then the chances of having a pregnancy from a single egg collection will be over 70%. Now that's a success rate, and many clinics might tell you that that is a success rate. However, it's very important to recognise that for those patients who are older than that, or for those who are unlucky enough perhaps to have less embryos available to them, then that equation will change. And I think that's why it's very important in the course of treatment that you communicate with your doctor and understand how those things that are specific to you might change that probability.